Welcome to another episode of Let's Talk About Mental Health. I'm Nels Closter. I'm an addiction psychiatrist and I work in Southern Vermont.
And my name is Robert Stack. I'm a licensed alcohol and drug counselor, licensed mental health counselor. And this evening, before we begin the show, I want to talk to you truly a public service announcement. And that is that right about this time there's a renewal of the license with Comcast. And so here it is. If you appreciate local programming on your cable TV, please support BCTV. There's going to be a public hearing on Wednesday, October 21st at 7 p.m. on Vermont Interactive TV, located at Brattleboro Union High School. If you can come in person, that would be great. Or you can email PSB, which I believe is the initials for Public Service Board, psb.clerk@vermont.gov. And again, this is so important. I mean, not only for this show, but for all the shows that BCTV brings to the community and throughout the state. So this is part of the licensing, is that it?
Right. The Comcast has to renew their license for their contract in 2016. It expires. Okay. And they have to get what's called a certificate of public good, and part of that is that giving them the right to broadcast around here, that they're also going to give back to the community as far as supporting cable TV.
And I understand they're also looking for like some increased funding so they can bring some different services, different techniques, different equipment. I don't understand all of it, but so that's very important. And so we want to, just make that point.
Absolutely. If you're enjoying BCTV, it'd be very important to let that be heard to these parties.
Okay. Yeah. All right. So this is a new season.
Yeah. Back for a fourth season. Unbelievable. Right. And we have some ideas for this season, of course, right? Yep. We plan ahead. Yeah, and looking at a number of guests and a number of topics that have interested us.
Well, one is Robert Whitaker, who's been here before, has a new book, and you were hoping to contact him. I think the producer Andrew has reached out to him.
Right, we should have him here in December, I think.
Right.
And if people remember, he's written two books that are quite popular: Mad in America, which is a history of psychiatric care in the U.S., and the other one is Anatomy of an Epidemic, where he looks at some of the impacts of our heavy reliance on medications. And in both those books, he's in a way making the case that there are some negative effects to what we're doing, and we might not be on a good path. And actually now this third book that he's written is Psychiatry Under the Influence. And what he's doing with this is looking at the relationship between the American Psychiatric Association and the pharmaceutical industry, big pharma as people refer to it, and that this marriage between these two organizations has actually moved both of psychiatry away from its primary focus of helping people. And so it's a very important book.
And I hope that while we do this and we talk about what's happened to the treatment of the mental health community, I mean, one of the things that we need to do is talk about maybe some alternatives. And as you know, we had a discussion sometimes about the split when talk therapy sort of went away and it became more about medications and getting people medications and stuff like that. So I hope that's part of our discussion is taking a look at that. The other thing I thought you might want to mention is your experience, what you've been locally teaching.
Right. I got talked into teaching a part of a larger course at Marlborough College. It's called Speech Matters. And what they're looking at is the way that language is used to sort of form our ideas about addiction in this case, and also how that conversation occurs. And talking about sort of rhetoric and debate, looking at policy issues, women's issues, issues of race. And I'm just offering sort of the on-the-ground sort of, real-life sort of piece of addiction to the students there, and really enjoying that. Yeah.
And we're hoping to have one of the professors on. I mean, is that
right? That's right. Yeah, Meg Mott, who has organized this course and taken the lead on it. Also, people might recognize her. She's a political science professor who has written a column in the Brattleboro Reformer with some regularity. And so I have her on here to talk about the ideas behind this and what she and the students are seeing about the policy arena with addiction and things like harm reduction, for example, and the big rally, the Unite rally for addiction that was in D.C. recently. So we've been doing a lot of field trips and a lot of exploration of things that do and don't seem to work in the U.S. with addiction treatment.
Well, I've been reading one of the textbooks you gave me, and it was all about free will. It was about Canada, and a lot of the information, the statistical information was from Canada. But that's always been a dilemma, talking about addiction and loss of control, and yet, saying that it's your choice, it's your free will, and that, I talked about this last season a little bit, the idea that, when we start talking about it as an epidemic, we make it sound as if it's something that you innocently catch walking down the street, like a flu or something.
Yeah.
Whereas there's a lot of choices and decisions and lifestyle decisions and other things that go on. But at some point, and again, I've said this over and over, I mean, so many people start off alcohol or drugs, and it's a voluntary behavior, and it's something that they engage in, and they engage in quite freely and openly, and they dedicate themselves to using. But it seems at some point it becomes out of control. It seems as if they lost control, and it's no longer an exercise. And you interview an addict, and they'll say, "I can't stop." And it's a kind of interesting idea, since they're the ones that take the action to use. It isn't like they're overpowered or anything, So I'm really interested in having the professor on, because I want to hear more about this. I mean, how that works.
Absolutely, because, and like we've made reference to this in the past with some of our concerns about the idea of if you call addiction a disease, on the one hand that's helpful in the way that it seems to reduce stigma, because people realize that there are some say genetic and environmental influences, or nature and nurture plays a role. But there's also that piece too that sort of takes away responsibility, and it's always been very tough in our work, right, to sort of hold that balance of at what point is one responsible for their actions, especially once it gets to the point of their use is beyond their control.
And the other thing, I hope one of the things we do is we talk a little bit more about treatment for mental health. You're going to get, well, with all these things, and there's a TV show on HBO, and it's kind of like a comedy routine, but this man was making the point that the only time you hear about mental health in America on the TV, if you will, is when there's a shooting or something.
Right.
And invariably they start looking at the mental health issue. And you'll hear people who are normally very conservative, who, as far as I know, don't really support treatment. But rather than talking about guns, they say, oh, what we need to do is fix the people who are mentally ill, which in some ways is really not fair. I mean, because yes, it is true that some of them have mental illness, but that's not the issue. I mean, the issue is around guns, but also that it's sort of, I hope we can address that. That there's another way of talking about mental health, and many people who suffer from mental health are victims of violence. Right. And we talked about it last season. A lot of them are ending up in jail. A lot of them are going to jail for being mentally ill. I mean, so there's I hope we have more to say about it this year. If we can think about people who may come in and have more ideas about or comments about this. I mean, we've done that in the past, and I hope we do it again.
Yeah, no, that'd be great, because it is this shifting around from prisons to mental institutions, and it feels like this whole gun debate, when you talk about people who should be screened, and if they've been committed, they should never have weapons, it's sidestepping the issue. It's like, rather, don't look at us over here with the guns. Let's look at those people over there who actually did the shooting, and not looking at maybe the environment, the social structure here that sets up those sorts of events. Right, and there's other, so I just brought that up. I mean, and obviously the other thing that we almost have to talk about, I mean, is what you were saying, the opiate epidemic. Right. I mean, we really have to take a look at that. And I was reading in the paper the other day, Governor Baker of Massachusetts, it was a headline in the Globe, I think it was, he was talking about involuntary hospitalization for addicts. And I think if I read it right, you hate to get your information from headlines because they're often misleading. Yeah. But I think what he was saying was that in Massachusetts, if you can get two people, a doctor, or I'm not sure how that is, to testify and go to a judge, you can get involuntary hospitalization. Yeah.
They used to call it a section something, you know.
Yeah, based on the number in the legal
yeah, and
code.
they would go to Bridgewater, and that wasn't good. But the idea, and then I was really struck because one of the things they said, we were going to give them 90 days of treatment. Like, boy, you know, like hold them in the hospital. Well, I would love to get back to the day of giving 90 days of treatment to addicts and alcoholics.
Yeah, you can't even get 28 days anymore, right? Or 30 days is what we used to do.
And you know, what's the idea? And you know, and I'm sure they're going to dial it back and say what they're talking about is like 72 hours. But even that is, I'm not clear about it because as far as I know, and maybe you could say more about this, but you know, coerced treatment really doesn't work that well.
Yeah. Well, so I think as much as we try not to make this a show just about you know, opiate use issues, it looms so large in the press all the time that it's really hard to step away from it. And you know, people want to hear about this, and people are desperate. And I think this whole plan by you know, the Governor Baker really smacks of that sort of desperation. And the constituents are wanting something. People are dying. You know, families are suffering with this, and you know, can't we do something about this?
Yeah, you know, recently I just started to volunteer as a guardian ad litem in the court system, and it's very challenging. It's incredible. It's a volunteer position, but you sort of act on behalf of children, babies, people who. I won't get into the whole thing. Maybe we'll have somebody on from that system. And I've come to appreciate the hard work that the people in the DCF do, children and welfare families. It's you know, recently here in Vermont, you know, everybody knows that we had a worker that was killed. And it had to do with the placement of children or taking the children out of home because of heroin use and stuff. And it's very complicated. I mean, it's sort of, and it's a, you know, when you hear the words, you hear like it's an epidemic, but there's people involved, there's families involved, there's children involved, there's babies involved, and you know, it's like you want to do the right thing by all of them.
Right.
You want to do the right thing by society, you want to do the right thing by the baby, by the mother, and everything, and yet, you know, at some point you have to make, you know, choices and decisions. So I'd really like to talk a little bit more about that. I mean, not only your experience as somebody who works in the field and runs a clinic and stuff, it's, you know, how do you help people? How do you make decisions about that?
Yeah. So how do the people at the front lines do this? Because I was just talking to one of the district attorney in Bennington today, and as we were sort of talking about an upcoming case, we're talking about these were not things that any of us learned in medical school or in law school, that the important piece of the work that we do is really in this sort of social dimension. Are the parents adequately parenting their children? Are they offering a supportive environment? Are their children safe? And the question of what's the best thing to do for a child, and if you're going to split up a family in the interest of the child, those are agonizing decisions by very responsible people. I don't think anybody takes that lightly. But certainly if you're on the receiving end of a DCF investigation, you don't have the sense that they're there to help, so there's really an antagonism as a part of that system. So I think if we get somebody on the show to talk about that, that'd be very interesting. Right. Sort of show a human side to DCF beyond what we see in the press these days. Right.
And the other thing that is, you know, current, and I know we talked about it last year, and I have my soapbox and everything about this, you know, but it's all about the legalization of marijuana.
Yeah.
And I know you recently have written or am writing a article, right?
Yeah. No, I find there's an upcoming hearing on November 3rd with Jeanette White and the General Committee in the Senate, and I'm just finding myself more and more perturbed by this sense of urgency around legalizing marijuana. That it has to be done now because, I mean, first of all, every other state that's legalized marijuana has done this through the voters, through a referendum. And Vermont would be the first state to approve legalized marijuana through the legislature as opposed to through a popular vote of the people. And with Peter Shumlin being in favor of legalizing marijuana, people are seeing this as sort of as an urgent issue to take advantage of the fact that if a bill gets to his desk to legalize, that he will either, you know, sign it or ignore it to the point where it becomes law.
Right, and I've seen that, and I've seen that they've had hearings and stuff, and our local senator, White, had we're going to do it the Vermont way, and it seems like everybody's talking about it's a done deal. So I'm starting to suspect they counted the votes, and they're pretty sure they have the votes.
Yeah.
I mean, within the legislature, and we have to accept it. I heard someone saying, don't get caught with pot until it's legal, or something to that effect.
Yeah.
I mean, so it's sort of. And I just think it just worries me to death. I mean, that this is, people have got the wrong idea here. One of the first things we're going to do is legalize pot. Then we're going to put out public service announcements telling kids not to smoke it.
Yeah.
Or be careful with it. And I think we ought to know more about, like, the medical marijuana. How's that going? How many people are getting it? How much is diverted?
There's a great black market for medical marijuana. It's been a great tool for the legalization folks to wedge their way into states. And the science is just, not there.
And do we want to become the marijuana dealer for the rest of New England? I mean, that was, I don't know if you remember that headline. It says, we're going to get $100 million in taxes.
Yeah.
But if you went down to paragraph 12, it was basically based on the idea that we would be selling to a lot of people, not just to Vermonters, but to other people. Now, how are they going to stop that? I mean, the way it is now in Holyoke and some cities, if you see a car with Vermont plates, they might pull you over for a heroin or something. But, I mean, what's going to happen when you see a Vermont plate in New England? Is it transporting marijuana? I mean, I don't know if this is really the right thing. And the way it's being talked about is the tax dollars. It's the tax dollars. And I know I'm repeating myself, but I can just hear him now. We'll use the taxes from marijuana to pay for treatment for opiate addiction.
It's crazy. And then I'm writing a column for Speech Matters column through the Brattleboro Prevention Coalition. It should be in the Reformer around October 31st.
Is that speech matter, or is it a
I'm sorry, matters of substance.
There it is.
I'm sorry,
Right.
matters
That's
of
okay.
substance. I'm sorry, I got stuck on the old idea there.
Yep.
And what bothers, and again, as addiction professionals, we have this bias where it's going to be bad to introduce another drug. Please don't do that. And I'm trying to sort of back up and say, okay, if public opinion is really supporting this, and if it's seeming fruitless to fight the idea of liberalizing the access to marijuana by making it legal, I don't think we're engaged in the right process for that. Decriminalization, which is the status we have right now, is shown by the experts not to increase use of marijuana.
Mm-hmm.
It accomplishes the goal of not having criminal records for using marijuana, not having more people incarcerated and arrested for the use of marijuana. And importantly, like I said, does not increase the use. If we go to legalization, it increases the use of marijuana without a doubt. And we know then that estimates are 10% of people who then use are going to become dependent. So I think, and like you were saying, what's the sort of the craziness of legalizing it and then putting up public service announcements? I think we really need to look up front. I think we should make the demand, what do we have to do to be ready to legalize, rather than now that we've legalized, what do we have to do to combat the effects of it, negative effects of it.
But I think they think politically the time is right. And like you said, the governor's on board, and I'm sure they count the votes. And it's kind of sad that it's a sign of progression. Rather than a single-payer health system, which went by the wayside. The sign that we're a progressive state is going to be that we smoke pot. And the legislature passed it. But there's something else I wanted to bring up if we have a moment, and just to say that the original idea of this show was to help an individual. And that's really always been my idea, is that if we can help somebody. And we've asked for phone calls, anything like that. And one of the things that we realized is that perhaps we've been underemphasizing people texting us. Send a text. I would love to answer anybody who has a concern, whether it's about a diagnosis or a family member, something that's going on. And the way we thought originally, when you and I talked about this, was that this would be a way for people to anonymously reach out to us and say a little bit, ask a question. Maybe if you ask a question, not only do you get an answer or a comment, but other people will get the same opportunity to hear more information.
Yeah.
So,
because I know when I was in school, they always said, no question is a stupid question.
right.
And even when I thought I had what seemed like a stupid question, I would ask it anyway. And always after class, somebody would thank me for having asked that question because it was something everybody else was struggling with too. So I think to realize that if it's your own personal question, it's definitely going to have it's going to meet some concerns for other people out there too.
Okay. Anything else coming up that we should talk about?
Well, we traveled a little bit, didn't we?
Yeah, well, we can do that.
Yeah. Well, I mean, one of the things that fascinated me, and I appreciate they do this course at Marlborough College, Speech Matters, and the research around that and thinking about, legalization, decriminalization, is what do other people do around these things?
Right.
People are always bringing up countries like the Netherlands and Portugal. Here we're pointing to, what's going on in Colorado, what's going on in Washington State, and I think these are important things to look at because there's no right answer to any of these issues that we're talking about. There's no one right way to address mental health. There's no one right way to talk about the marijuana issue. There's no one way to deal with the opioid addiction and its treatment. So let's it's interesting to look around at how other countries and other places have approached these issues that we all struggle with.
Right. As you know, this past summer I spent a little time in Ireland recently, and I'm sitting there reading an Irish Times, and like page 8 or whatever it was, they were talking about introducing Suboxone.
Yeah.
They're like, we have people on methadone, and they had an interview with a opiate dependent person who was on a high dose of methadone. He said, I can't wait to switch to this other drug.
Yeah.
And I mean, it seemed like they didn't quite understand how Suboxone worked. I mean, that he was at a higher dose. Anyway, so it was a moment for me anyway, just to read the paper and look at it and understand. They're struggling with the same thing. They had, the heroin addiction or codeine pills and everything, and they have methadone. They're wondering if there's something else they can use and how to do that.
Yeah, I mean, we think that's reasonable. We have all these options here. But and I think too that one of the things that really struck me with other countries is that they have looked at addiction in particular as a health issue, and they've been looking at it as a health issue for well over a decade now. You can see that by the programs they've enacted and the way they treat addiction. So in Norway, for example, where I was, it's really in essence they've decriminalized all drug use because they're wanting to get people into treatment. And they've made a point because they realized they had one of the highest rates of heroin overdose deaths in Europe, that they had to do something about getting medication-assisted therapies like Suboxone and methadone out there in the country so that they could help to take care of this terrible health issue.
Right. And the other thing, I was sharing with you the other day, I saw an article about up in Burlington, they had over 300 people waiting to go on Suboxone, and there was no doctors to take them up to provide that services. In Vermont they have the hub and spoke, right? And the hospital's the hub, and the spoke is they go out to other clients, right? And they were talking about how they have a number of people at the hub, and they didn't have a lack of providers who were giving it. And I just wonder, just how that's going to work. Because I don't know the numbers, but I imagine there's more and more opiate addicts. And it seems like we're sort of over-relying, if you will. I'm sorry if this sounds wrong. But, we need to get medication to them. We need to get opiates to them. And I'm old school, and I'm thinking, how about abstinence? How about education? How about 12-step programs? How about turning points? How about, I appreciate medication-assisted therapy. I understand that. But to me, it seems like it's almost like the emphasis these days is like we got to get them the medication rather than the emphasis is we got to get them better.
Right.
And I know that you practice this. It's fun. One thing to say, let's get them on medication. Then, let's get it better. But is that happening? Is that happening in Vermont? And so I think we ought to take a look at that and talk some more about that.
Yeah, no, I'm very concerned about what our prevention efforts are really like here. How do you stop people from getting into this situation? Or how do we make families healthier? I mean, if you look at prevention around marijuana, for example, we must not be doing a very good job because according to the National Survey on Drug Use and Health, Vermonters from 12 to 17 years old have been at the top of the country for the last couple of surveys as far as the percentage who use marijuana.
Right.
So if we're talking about legalizing this, increasing access, we need to do a better job of getting out the message there to stop kids from using.
Well, it is a drug. I mean, it's a drug, and it changes your perception of reality. I mean, if you took a toke and it didn't do anything, you'd want your money back. I mean, you know, what you're looking for is a change in reality, and I think it's in some ways it's boy, this is really going off the wire, but you know, it's almost as if people are looking for something to make sense of their, like, who they are, what they do, and rather than figuring that out, which is kind of difficult, hard, it's easier to get high. It's easier to get stoned, and I don't know. We've been so busy saying let's legalize it. I think we've been saying that it's sort of benign, that it's not going to hurt anybody, it's not going to harm anybody. But I think it does. I think we've got to be really careful about this. I mean, I can't imagine, and I've said this last year, I can't imagine being a single mom or even a two-parent household telling a teenage, you know, don't smoke pot or do your home, you know what I mean? It's like, it's not good for you.
Mom, it's medical.
Know. Maybe I got this wrong.
Yeah. I don't know. I think, too, this whole idea that we have around this disease model, too, is just not helpful either.
Yeah.
Right? I mean, in a way, we're talking about our concern that it relieves the individual responsibility. But also something put the idea to me this summer that the idea of the disease model also then seems to forgive the state or the government or community of a responsibility for marginalized people, for people who get involved with drugs, because that's a disease, we'll throw medication at it, as opposed to looking down deeper for the sources which might lead people to drug use or make them more vulnerable to drug use.
So I hope by my comments I'm going to encourage people to send in questions and comments.
Yeah.
I mean, really, there's a lot going on. We're going to take an opportunity again to mention this really important thing to support this show.
Right. So again, you know, the Comcast contract for providing cable services in Vermont is expiring in 2016. So to renew their certificate of public good, they need to show the Department of Public Services and the Public Service Board they're meeting community communication needs. So that's why we need these people to hear from our viewers here at BCTV, to, you know, mail comments to psb.clerk@vt.gov and refer to docket 8301, or also there's the public hearing October 21st at the Vermont Interactive Television at Broadbury Union High School.
Right, and I think it's important that we understand this is Comcast, and all we're asking Comcast to do is give some of the money that they collect from everybody every month, that incredible bill that you get once a month, and you know, make sure that you get some of that money come back to support community TV.
Exactly.
I mean, that's really what it comes down to on some level. You know, they want to provide better services, and we really need that support. So.
Yeah. Absolutely. I mean, we've enjoyed being on TV, so if you've enjoyed watching programs
Not
like ours
just us,
and
but other ones too.
Other ones as well, yeah. Yeah. So again, we've been throwing out ideas. I think we're trying to give a little preview for the season coming up, people we want to talk to, ideas we want to explore, and hopefully that's excited some thinking in viewers to hit on one of these topics and write us some questions about these issues.
So thank you all very much, and I hope we'll see you next week.